Hello, everybody. Welcome to my podcast. Today, we're going to be addressing a key health challenge of the century, dementia. Globally, over 55 million people are living with dementia, and the epicenter of this crisis is right here in the Asia-Pacific region, which is home to more than 20 million cases, the highest number globally. And in Hong Kong specifically, the burden is staggering. About 1 in 10 elders aged 60 or above is living with dementia, and prevalence reaches up to 30% in those over aged 80. But what many people don't realize is that in East Asia populations, vascular cognitive impairment caused by damage to blood vessels in the brain due to high blood pressure, stroke, and diabetes is disproportionately high. Vascular dementia is the second most common cause of dementia after Alzheimer's disease. And in primary care, the tools to detect this early in middle age is quite limited. That's why I've invited a special guest today, the co-founder of Grey Matter Solutions, to help me explore a digital tool called ReCognAize. Welcome, Adnan. Please tell us a bit about yourself and what brought you to develop the app ReCognAize.
So I'm originally from an engineering background, and I was always very interested in neuroscience and cognitive health. And through that journey at NTU, where I did my undergrad, I met a professor in neuroscience, and I just wanted to do something in this space which could help people. And by working with him, he's actually a neurologist, sitting in clinics and seeing some of the MRI scans. I got educated about, the growing burden of cognitive impairment in the Asian population, which kind of led me to pursuing a PhD as well in the same space, and eventually developing the application and now looking to bring it to patients and working with clinicians like yourself to do that.
Thank you. Incredible. And it's really great to see that you're trying to also improve the way that we diagnose cognitive impairment, because, like I said before, some of the tools that we use in primary care is actually quite blunt. And the issue is that if I test my 50-year-old patients, most of them are actually going to score 100%. And there are differences between, it's not just memory that's impaired, but there's also things like executive function and speed processing that seem to be a key in terms of looking for signs of vascular dementia. So tell us how you actually came to work with your co-founder on this app.
Sure. I think I always feel that we should learn from others' experience. And one of the things that we know, and a lot of clinicians in the Asian region would tell you that MRI scans in our population look very different from the Western cohorts or the Western patients. And traditionally, a lot of the patients have been diagnosed with Alzheimer's disease. We all know about Alzheimer's. We've heard about it. But if you talk to neurologists in the region, they will tell you that they see a lot more white spots on an MRI scan from an Asian patient compared to a Western patient. And those white spots are actually called as white matter hyperintensities, which we can also think about as silent strokes. So these are strokes in the brain which have not become a full-blown strokes, but they are silent. And there have been small changes in the brain's anatomy. And that is what my co-founder, Prof. Nagendran, highlighted to me, that there is such a big problem with vascular changes in the brain. And so how vascular cognitive impairment usually manifests is with reduced thinking speed. So you might be trying to recollect something, but you're slower, or finding directions to go to a certain place. Maybe we think that previously it used to be easier to navigate around this area, but we wouldn't link that to memory loss, right?
Yeah, because most people think, I've forgotten something, or I can't remember my address. They think of it more as a memory issue rather than a speed of processing.
And also, for example, you mentioned executive function. So someone might be working and be a very fast decision maker, but maybe sometimes they are slower in making decisions. And traditionally, no one would link this intuitively to memory loss or Alzheimer's or cognitive decline. But that's the research that we're seeing, that due to the vascular changes in the brain, which doesn't happen in the memory center. So the memory center is the hippocampus that we know. But the vascular changes changes happen in the front part of the brain, which is usually associated with decision making, speed of thinking. And that is really worrying, right? Because there could be so many patients who actually don't have memory symptoms, but they have already started having cognitive decline.
And also with the symptoms and the changes that are occurring for dementia, they often occur 10 to 15 years before you actually see changes in the brain. So it seems like midlife is the time to actually start to focus on some of these risks and assessing those.
Yeah, so that's one of the things. For example, the Montreal Cognitive Assessment, or the MoCA, was developed a long time back, decades ago. And even the definition of disease back then was different. And when we have such a tool, which has been designed to detect more dementia or mild dementia, it's not the same as detecting even earlier. And we need tools that can capture subtle differences compared to, of course, if I can't remember my family member's name, that is pretty bad. I don't think we need a screening tool for me. But if my reaction time or my processing speed has gone down by 20% in the last 5 years, can we really capture that with pen and paper based traditional tests? I don't think so. And that is where the role of more enhanced cognitive testing comes into play.
So I also understand that with the traditional testing, there's also issues in terms of lower education. Because one of the problems is if you have a low level of education, those traditional tests can actually show that you have cognitive impairment when you actually don't. So the issue with that causes a bit of bias. And then the other problem also is with language. And so I think like one of the things that your tool actually does is that it helps to minimize those issues. So can you tell us like what are the components of your app or tool?
So just to summarize, one of the big differences in different populations is the cultural context. And one of the tests in the MoCA is a clock drawing test. And that might not be relevant for people living in sub-Saharan deserts, for example. But they are not cognitively impaired, most likely. So tests need to be ecologically valid or relatable to the population. That is why we have grocery shopping game, where you have items that you remember and then the list disappears. And these are items which are very easy to customize to different populations. I understand that the grocery items might be different in different countries, but universally we know that we go to the grocery store and remember things or try to remember things. So that is how we incorporate ecological validity. Another component about language. So language is one of our key cognitive skills, but we want to measure cognition independent of language. So we need to create tests that are language independent as well. And similarly, in ReCognAize, we have tasks that measure processing speed, but using numbers instead of letters. We also have this test called the trail making test, which is a very well validated test globally for executive function. But instead of using letters, we use shapes. So the traditional trail making, you connect the numbers to letters, where 1A to B, you make a trail. So instead of the letters A, B, C, D, we use shapes, where you connect the numbers to the shapes in increasing order. So those are some of the ways that we try to make it independent of language.
And apart from it being really independent and also culturally neutral, it's also quite fun to do.
I'm glad to hear that.
Although I would suggest doing it in a quiet room. But I mean, I think it's great to be able to find the nuances and also early onset, and to also improve the ability to detect differences using this tool. But the other thing I was thinking about also is, what about people who are not used to using, say, iPad or a platform or, a digital tool? We talk about sort of the socioeconomic biases, but what about the digital divide? How do we minimize that? What can we do to help like an older person do the test?
So firstly, I think everybody has different preferences when it comes to the platform. we are agnostic across platforms. So the test can be done on a laptop or a computer as well as a tablet or your phone.
Yep.
For the older adults, maybe a tablet or a computer might be more feasible. But we also realize that having a very thorough guided process inbuilt with a good system of taking the person, teaching them how to do the test, and then giving them practice rounds is really useful to get them doing it. I think this is an evolving space. Digital is, of course, way more scalable than administering tests. But I think there is obviously a population that maybe cannot or does not want to do digital tests.
Yeah.
That's where we may need to have some physical tests.
Right.
For example, the grocery shopping game could be done in an actual grocery store, which could be quite fun, actually. So those are some of the ways we can try to make it accessible. However, the biggest accessibility is shortage of healthcare workers.
Yeah.
And I think digital is the only way to do things fully remote and fully scalably. And I think our population is getting more and more digitally savvy, maybe too much sometimes.
Yeah.
So I'm hopeful for the future.
Yeah, and I think we're very lucky here in Asia. I find, like, I don't know if in Singapore, but in Hong Kong, we're very early adopters, you know, of digital tools, because we find that Hong Kong is, you know, a lot about efficiency, and, you know, we want to be able to access things very quickly. So I think it's just a matter of time that, you know, we would be able to make these resources more available. And it'll be interesting to see how this space actually evolves. Yeah.
Actually, Singapore has more than 100% digital literacy or digital penetration rate,
Wow.
a smartphone penetration
Yes,
rate.
yeah.
So more than Singapore's population, number of mobile phones in Singapore.
Wow.
So, and I think since Asia is probably the hub of technological innovation, I think healthcare innovation should also be or match up to those standards, I think.
Yeah, and I think even like for Hong Kong, we have a very good system in terms of like identification, which basically is a primary care, but also a private-public interface exchange platform for doctors, but also patients.
How are patients, I mean, in general, are they receptive to digital health?
Yeah, I think here in Hong Kong, the government does put a lot of effort into encouraging registration. So once you actually get registration, you can get very good subsidized health screening. So that's one of the incentives. So the government here is very good at incentivizing people to participate. And also from the health practitioner perspective, they also to come in and assess your platform to see whether or not it's able to connect with the government platform as well. So there has been a lot of support throughout the last couple of years. And so slowly I'm starting to see here as a practitioner how things are changing. So it's really good to see. And, I think that this is the way forward, is using digital tools in terms of in clinical assessment. One thing that did come up, which also was a limitation of previous tests, is that previously, like the MOCA, it's always the same test. So it's possible that I'm going to learn it and get good at it just by practice. So this is, I think, something else that you address.
Actually, it's not possible. It is definite that you will get better at the MOCA. And especially even if they have an A and a B, actually a lot of items are the same. So MOCA has a very high learning and a practice effect. And that is something that we want to minimize with digital testing. It's very easy for us to randomize things and make many more versions than the MOCA, for example. For example, the grocery list can have so many items in the bank that it's much easier to never have a learning effect. And similarly, we've created tests that are fully repeatable and can be used for monitoring, because there is really no way you can memorize, because it's different every time. Yeah, and that is why, I don't know if I should say this, but I heard that Trump took the MOCA 3 times until he got a good enough score. So that really shows that maybe it's not ideal to get an objective.
Especially if we want to look at trends over time. And this is kind of where I want to pivot a little bit, because most of my audiences are women. They're in midlife. They're going through perimenopause. So they're not quite menopausal, but it's the 5 to 7 years leading up to menopause. And one of the most common symptoms that they complain about is brain fog. So forgetting words, forgetting where they put their keys or their phone. And sometimes it's like myself going into a room and then can't remember why I was there. And so when I first sort of came across your tool, I thought, actually, this could be really helpful because estrogen, when we start losing it, actually affects the bioenergetics of the brain. And the good news, though, is that it doesn't mean we're going to get dementia because most women will actually stabilize and recover. But I think it would be good to have a tool that helps to reassure women that what they're experiencing subjectively can be captured and they can see it objectively. And then they can monitor that process over time. And I wonder, like, if you think about that, like, what your thoughts are on this area and utilizing it this way.
Yeah, I think that is very important aspect of cognitive health in general. I watched the M Factor 2 screening in Singapore, and Prof. Lisa Mosconi talks about neurological effects of perimenopause. So just understanding perimenopause and how hormonal changes can lead to cognitive impairment, but it's reversible or it's temporary cognitive impairment or cognitive decline, we would say. So I think how the tool can be beneficial is not just giving reassurance, but giving objectivity to this unmeasurable thing called brain fog.
Yes.
And I don't know if that is your experience, but I think that's the purpose of different devices, different measurement tools that we use, like Apple Watch and Aura and so on. I think it's not just to tell us where we are at, but also to just paint a picture of our cognitive health objectively. And that could also help patients in understanding which domains are being affected possibly. And another thing is if there are interventions, which I'm sure there are, like hormone replacement therapy and other perimenopause interventions, which look to improve their overall health, one of the metrics to track could be their cognition.
Yeah, absolutely. Because when I do any assessment or any blood test or any kind of screening tool, it's always in context with the whole person's health. So I'm also looking at things like their lifestyle. Are they getting enough sleep?
Yes.
Are they chronically sleep deprived? Because that's going to affect their performance as well.
That is something that I'm quite interested in. Do you think there is any relationship between perimenopause and the vascular health system, which may also be linked to their cerebrovascular or blood flow in their brain, possibly?
Yeah, I think that's a very interesting topic because when we used to think about menopause, perimenopause, we think about vasomotor symptoms or typically called hot flashes. And so there is some scientists who believe that hot flashes themselves, even though they're troublesome, they're not necessarily benign. That there is actually an association, and not a causation, by the way, so just an association with increased risk of cardiovascular or cardiometabolic risk factors. And how that actually occurs, I think we need to explore, and I'm curious to find. I think we would need longitudinal studies to follow women through to measure all these parameters and markers to see how does their cognition and their hot flashes and all the other metabolic symptoms might be associated, and then try to tease out some of the cause and effect. So I think it's a really interesting idea.
Yes, definitely. And it would be interesting to see how cardiometabolic interventions also may be helpful for perimenopausal symptoms. They are helpful for cognitive health. So maybe the cognitive symptoms could also be helped with cardiometabolic interventions. And because there are a few clinical trials, such as the FINGER clinical trial and the US Pointer clinical trial, which talk about holistic multi-domain interventions for improving brain health. And one of the big pillars is vascular health. And you know what, actually, I think sometimes when we talk about dementia or cognitive decline, there's a fear. But what I want to say is that the lifestyle aspect, all the things that are modifiable, and there are 14 of them, actually, because quite a lot that we can do, that contributes to 45% of the risk factors, which is quite significant for dementia. And so if we can manage and optimize our blood pressure, if we can manage and optimize our blood sugar, our weight, I'm not talking about aesthetically, but, just visceral adiposity is a major risk factor for heart disease because the fat is inflammatory. If we can manage those things, not smoke, make sure like we're getting enough movement and eating a balanced diet, all those
healthy things, we can actually have control, especially when it comes to vascular dementia, because we know those risk factors. So I think that the message is actually hopeful. And that's the reason why when I look at my patients, I'm not just looking at one aspect, I'm looking at their entire metabolic, hormonal health and lifestyle. And what I think it's really interesting and great is if I can correlate some of the areas where lifestyle can make an impact and then track the cognitive progress and see which functions actually are impaired or improve, I think it's a really great form of feedback for people to keep up their healthy habits. So
yes, I mean, ReCognAize can serve as a feedback tool to not just measure where they are at currently, but the things that patients are doing, whether they are causing any cognitive enhancements and hopefully enhancements.
Yeah.
And I think that's where we also want to differentiate whether someone is actually declining, because we do need to find out whether someone is at a risk of cognitive decline, which might need further investigation of their biomarkers, of their MRI scans, and so on. So ReCognAize can be a tool that is used in multiple ways, I would say, to get a baseline understanding of our cognition, but also to see over time whether some of the things that we're doing are helping or not, and whether we need further investigation.
Yeah. So some of the things that I think we want to monitor, I mean, this is a question for you, because if I do a baseline test today and I make an intervention, say I try to get, good quality sleep, or I try to get instead of 6 hours sleep, I try to get 7-8 hours sleep. How quickly do you actually think that you will see that result or that impact?
Subjectively, you might start seeing the results pretty soon. But I would say we need to have at least 3 to 6 months of consistent intervention before seeing a meaningful impact. And this, ideally, the intervention for cognition should be multi-domain.
Yes.
Not just sleep, but also cardiometabolic risk factors, as well as potentially hormonal interventions, as well as keeping our brain stimulated. So in the finger and the US pointer studies, one of the big aspects of improving cognitive health is to be cognitively stimulated as well as socially connected. So cognitive stimulation such as playing mahjong or Sudoku. And we're also creating our own cognitive games, which could link to ReCognAize. And then after ReCognAize, patients can play those games. But also another important aspect is to be socially engaged. And social connection is a big, big factor for improving our cognitive health.
Yeah, so I think there's an association between depression and also cognitive decline. And as we start to get older, we tend to not go out as much, or we feel, more isolated. And that's also a really big risk factor for cognitive health. But what you say is really interesting, because when I personally did the test, I won't say which ones I did well in, no pressure. But I really noticed that some of the hormonal changes that I know related to the different types of functions like executive function, I can see how that actually is quite different. And in some ways it's reassuring to see that what I'm thinking is not imagining. That actually I can see that it truly is, say, not as good as my processing speed or my concentration, which I was very happy to see, okay, that's actually still really well preserved.
So my question would be, are there any specific cognitive functions that you would expect to see with perimenopausal brain fog?
Yeah, one of the things we know is executive function and also working memory. And that's often the complaint that comes up, but it could be the other parameters as well. So sometimes I'm not sure if what I'm seeing is a result of just practice, or, that person's practice, or that person is their habits, or whether I'm seeing a true signal. So that's why I'm curious, to ask you the questions. If I did the hormone therapy, if I really optimize lifestyle, and then I tested it again in 3 to 6 months' time, how much of an improvement would signal that something actually has, all the things that I've done has actually worked? Because that's an interesting area that I would like to explore.
Yes. I think any improvement that you do see can be considered true cognitive improvement. I'm assuming they're not doing the test every day at home secretly.
I was tempted about that. I was like, can I secretly do this every day?
Yeah. So that sense, that is true cognitive performance every time.
Okay.
However, I would have to say that if there is no improvement or there is worse performance, then maybe some further investigation might be required.
Yep.
And just to share with you now, we have the plasma tau blood test.
Oh, yes.
Tau 217, which can be done quite easily. And I heard it's also available in Hong Kong.
Here, yes.
Yes.
Absolutely.
So that plasma tau also gives us an idea of the amyloid accumulation in the brain, which is directly linked to Alzheimer's disease. And that's the protein that is highly linked to having Alzheimer's disease. So doing a plasma tau 217 blood test might give enhanced reassurance or requirement for further disease-modifying treatment.
Yeah. So I think that we like to use all these tools together with others, because I don't think there's one tool. And this is, I would say step one of the actual screening process. And then as we start to see impairments or things that don't improve, then we need to kind of escalate the investigation to clarify, is this really something more serious going on that warrants more investigations and treatment? So that's the reason why I can see how it's a very easily accessible anywhere test that you can do. It doesn't require me to be there to actually provide the test. So there's a lot of time saved. And I think being sort of in your own environment to do this test, you're much more comfortable with it as well. So I think that it's a way forward. So I'd like to then ask, because you brought up the tau protein, how does that correlate? Like, is there correlation between ReCognAize and also these biomarkers and future risk prediction?
Yeah. So going back to the definition of cognitive decline. Cognitive decline is a reduction in our cognitive performance. And that is measured through objective cognitive testing, such as ReCognAize. And that is our cognitive picture at that point of time. What happens biologically, or the reasons or the drivers of that cognitive decline, is where our MRI scans or our biomarkers come into the picture. And there can be patients who have impaired cognitive performance or reduced cognitive performance, but they don't have elevated levels of the biomarker, or they don't have white matter changes in the brain. So really, the most important part, I would say, is the cognitive performance first, and then investigating what could be beneath that. When it comes to correlation, we see a pretty good correlation between the plasma tau test and ReCognAize, as well as other cognitive tests. However, it would again depend on the population. So we need population-specific cutoffs for these blood tests. However, cognition is more generalizable because that only depends on education and a bit on age. Whereas biomarker tests are more individualized to our ethnicity, to different factors. So I would say the jury is still out on the biomarkers to a certain extent, especially in our population. Of course, the gold standard is imaging, because you're seeing the brain real time. So that would be another way of really investigating further. So along those lines, we've seen a very good correlation between ReCognAize and MRI scans. And we've seen also ability to differentiate between the vascular type of cognitive decline and the non-vascular or other cause-related cognitive decline. And that's the paper that we published recently, where we saw that reaction time is a big predictor of vascular changes in the brain. So people with reduced reaction time were more likely to have vascular-related cognitive change versus people with okay reaction time, but they might have other difficulties, are more related to not vascular related or maybe Alzheimer's related cognitive decline. So that is really the personalization that we can get from ReCognAize. Really looking deeply into the reaction time, the fatigue. For example, a patient might start the test really well, but get fatigued midway and perform poorly. So these are some of the really finer metrics that we capture through ReCognAize, and that goes into our scoring system as well.
So I think this is a very elegant tool that actually captures a lot of different parameters, and that really helps us to differentiate those specific risk factors that we can also track over time. And I think really the key takeaway is that you don't have to wait until you get dementia or cognitive impairment, because a lot of these things can happen in midlife. And so there are things that you can definitely do, and that is pay attention to your blood pressure, take a look at your family history. You know, do you have a family history of high blood pressure, stroke and heart disease, or even diabetes? Because if you know these changes early on, you know, there's a lot of time that you can actually have to actually make those changes. And so I think that the future of health is really positive, because we're getting more and more of these innovative tools to help deliver and make those assessments. So I'm really, congratulations on publishing that validation paper. It's incredible. I think research is very difficult to do. So any kind of research that gets published, I'm really excited about. So final question, or, you know, is there any kind of last things that you think the audience should hear about and you want to talk about?
Perhaps, I think at the end of the day, the question is always, what can we do about it? And I think having more tools that can support patients in taking charge of their cognitive health is super important.
Yep.
And that is our mission at Brain Matter Solutions, to enable patients as well as physicians to understand their cognitive health, as well as monitor and enhance their cognitive health. So we're building tools for all these three functions.
Yes.
And we are really excited to collaborate and work with physicians to bring these tools to patients. Because at the end of the day, we want to complete the whole ecosystem, right?
Yes.
From screening, monitoring, intervening, and enhancing. And I think that's where preventative health and longevity is moving.
Yeah,
and
absolutely.
It's a very exciting space to be in.
So I really like the fact that your tool is physician-led. So the participant or your client can go to their physician, and their physician can be registered as part of your provider, and then administer the test, so that then it gets interpreted again by their physician in context.
Yeah.
That's what I really love about it. And also you mentioned that there will be some ways to actually train our cognition. So I understand that's happening in the process.
So
you share a
along
bit?
those lines, two points. I think cognitive health is central to our overall health. And that is why for ReCognAize,
Yep.
the report is intended to be reviewed by the patient's healthcare provider,
Yep.
which could be a primary healthcare provider or a specialist like a neurologist or a geriatrician. And I think that is super important, because there's so much nuance behind our cognitive performance. It could be due to sleep issues, could be due to perimenopause, or even cognitive decline,
Yes.
neurodegeneration. So that is why we love working with healthcare providers, and whoever is interested to take up or try the test can go to one of our partner healthcare providers to do so.
Yeah.
And coming back to the intervention, so we have been building a personalized cognitive training platform, which uses the patient's performance on ReCognAize to personalize cognitive training plan for the patient, where they will get regular nudges and regular notifications to play a brain workout, which is
Wow.
personalized to their profile.
Yeah.
For example, someone with challenges with executive function and attention requires a different sort of cognitive training compared to someone with more memory loss related symptoms. And that is where we have our second product, ReVitalize, which we're hoping to launch pretty soon. And it's not standalone in a sense that it goes with other interventions. So any cognitive training intervention should also go with other healthcare interventions,
Yes.
such as improving physical parameters, cardiometabolic interventions, and maybe hormonal therapy as well. So we want to work together with partners to make that whole ecosystem to improve cognitive health.
Yeah, I'm pretty excited about that, because, you know, when you say multimodal, I straight away thought learning to dance, because you have to remember the choreography and then you have to move at the same time. And then, but if you also had another tool which you could specifically tailor to yourself based on your results, I think that's incredible. And, we're moving towards precision medicine and personalized medicine. And I honestly think that it's becoming more accessible. And I really, the reason why I really love primary care is because we see our patients regularly all the time.
Yeah.
We understand who they are, we have a relationship with them, and we can actually monitor them for various things. So I think this sits very nicely, and I think any doctors out there who are interested in this, please contact Grey Matter Solutions. And also I'm really looking forward, to using more of this tool in our practice. People talk a lot about longevity. What's your take on that, specifically on brain?
I think brain is the pillar of longevity medicine, because everything that we do and we perceive flows through our brain. And that is why one of our core missions at Grey Matter Solutions is to enable personalized brain longevity, better detection of cognitive symptoms, as well as monitoring and then intervening and working with physicians in the preventative health space to create that brain longevity ecosystem.
And to you, what are some of the key takeaways that are critical for brain longevity?
So this comes as not a surprise, but most of the things for longevity are things that we've known for ages. Diet and exercise, but going deeper into it, going deeper into what are the exact cardiometabolic factors or for the specific patient to improve. What is their, maybe they need an ApoB test or other kind of vascular related tests to go deeper into their parameters. But I think at the end of the day, from a brain longevity perspective, it's really stimulating your brain regularly, taking care of your cardiovascular risk factors, and then being socially engaged. Those, I would say, are the three pillars of brain longevity.
Yeah, and they're all the things that we can do today. Regardless of what testing you have, I always say that the lifestyle aspects are the key foundation to all interventions. And then you might start to add some supplements, you might start to add some other types of training tools. And I think all those things are, additional to what you're already doing as foundation. So thank you so much for coming today.
Thank you.